Craniopharyngioma, there's actually two disease entities that arise in a little connection that our brain has with the pituitary gland. When we're embryos, there's a little tissue that comes from the roof of our mouth and our brain, and they touch and they create this complex tissue that is responsible for all the hormones in our body. Some of the cells there can give rise to these tumors. There are generally two kinds of craniopharyngiomas, what we call papillary craniopharyngiomas and the Adamantinomatous craniopharyngiomas. Papillary craniopharyngiomas tend to affect people later in life. Adamantinomatous craniopharyngiomas tend to affect younger patients, so it can impact their growth, the growth spurt, and it can impact patterns of eating that are unusual. So it's a little different in adults. Many times they would have visual disturbances. Sometimes they can be a little bit more insidious and they can have issues with endocrinopathies, so lack of hormones, especially in women with disruption of their cycle. Once a patient has specific symptoms, this would lead to imaging, firstly of a CT scan and subsequently with an MRI scan. That's usually what would show this tumor and pinpoint the diagnosis. Certainly the most definitive way to cure these tumors is surgery. The advent of the endoscopic endonasal corridor and procedures have really revolutionized the way that we treat these tumors. It allows us to much better visualize the interface with the normal structures that are extremely sensitive, such as the vision nerves, but also the hypothalamus, which is our homeostasis center. UPMC has one of the largest experiences in treating this particular disease, both in children as well as in adults. We also have a comprehensive program that offers all aspects of treatment for craniopharyngiomas. There's ongoing research for craniopharyngioma, and we are part of multi-center trials, essentially revolutionizing the treatment of craniopharyngioma, not only from the surgical standpoint, but also better understanding the disease entity and creating more gentle ways to treat craniopharyngioma, either before or after surgery.